All right, welcome back to the Rural Health Equity Chat, everybody. It's great to see some new faces, some people that I've seen before. So today the plan is to talk a little bit more about what we as a group and maybe our network more widely could possibly do to start thinking about taking some strategic action towards some of the rural health equity challenges that we are seeing. So for those of you that are new here, so this is a rural health equity chat. It is a bit of a space to try and raise awareness around rural health equity challenges, give people an opportunity to share the work that they are doing, the solutions they are finding in their local communities, but also just allow us all to learn, share, and possibly collaborate to address some of the challenges that we are seeing. So I'm Veronica, welcome. And today I will give a very brief 5 to 10 minute presentation around building a rural health equity strategy. So this is something that has come about really through conversations with all of you in this community. And it was something that was identified by the community as a project that we might want to consider working on. And over the summer, I had a few meetings with about 11 members from this community that came forward to be part of a steering group. And we discussed, what this might look like, how we might approach it. And really this session today is to present that to you, get your feedback on what you think about what proposed approaches, whether we're missing something, whether we're completely off the mark, whether you feel that, we should be taking a different approach. This is really about being as transparent as possible about how we're trying to go about this and getting your feedback on it. So to begin with, why build a rural health equity strategy at all? So we know that we have a lot of different persistent health inequalities, and in rural communities, this is also the case. Often in the UK, there are little pockets of activity going on around rural health equity issues, but there's still a lack of some kind of more coordinated approach kind of at a UK level, but even within the four nations, there can also be a lack of coordination around what should be done for rural and coastal communities. And we know that we have this challenge that's often brought up around lack of good quality data for, decision making around these issues. And I think it's important from our perspective here as a community from rural areas that often we feel like decisions are being made without consideration for rural communities, their needs, or what might actually be going on the ground in these areas. So as I mentioned, this kind of approach and trying to think about how we might tackle all of these challenges more strategically was something that repeatedly kept coming up in our conversations. So what are some of the drivers that have been identified? So there has been different reports and work done around trying to identify what are the drivers of rural health inequity in the UK. And this list has come from a report that was published by the NHS Strategy Unit in 2023. And they identified so that patients and services are geographically dispersed. They identified issues around funding and increased cost for providing services. They identified the demography challenges so that rural and coastal communities often have an aging population. We still have issues with digital connectivity in many rural areas in the UK. We have issues with transportation and public transport and connectivity from that side. There's lots of challenges around adequate housing. Fuel poverty comes up repeatedly. There's questions of deprivation, isolation, social exclusion. Within the NHS, we have workforce challenges with recruitment and retention, but I would say that this goes also beyond the NHS to social care, to education, to other workforce factors. So this isn't necessarily just within the healthcare sphere, but obviously with health equity, we're often focusing on that kind of health and social care aspect of things. There are often the bigger global challenges, so things like climate change, so flooding, fires, what does that mean for more rural communities? And also in the UK, so there was this question of coastal issues, so the kind of deprived coastal areas that were highlighted in the Chief Medical Officer's report. So those are some of the drivers. And I think we also discussed many of these during the different chats over the past 18 months or so. So when I had a meeting with the steering committee, I should say, I came with an initial proposal. And this was the initial proposal that I came up with after listening to all of you and all of your challenges. So the idea I proposed was to look at 4 broad areas and to take a life course approach. And what does it mean to take a life course approach? So this is very much aligned with the social determinants of health, and it looks at everything kind of from, how are we looking after children from birth, early years, going through to adolescence, young adults, working age, and then elderly. So it's taking that broad approach. And I've put forward 4 areas. One is aging population. The second is mental well-being more broadly. The third is connectivity, looking at both transport and digital connectivity. And the fourth was funding structures and investment into rural areas. And the way that I thought about this kind of aging population topic was that we would think about aging population, not just from the perspective of, we have people that are over 65, what do they need? But also, what does an aging population mean for children and youth, and how are they impacted? So this was the kind of way that I thought that we should look at this. So a bit more broadly, rather than perhaps just focusing on the, we have an elderly population, that means more healthcare, that means more social care, but thinking about what does this mean for schooling? How does it affect, we know that schools, both primary and secondary schools, have kind of been closing in different areas. And what does that mean in a rural community? How does that affect what happens? And does it actually lead to possibly more aging in the community because young people are leaving that community to go find work or education elsewhere? So kind of looking at it a little bit more broadly within all of the social determinants of health that we talk about. Similarly to mental well-being. So that will look different for younger working age and more elderly populations, but also there's some key threads that go through the mental well-being space. So things like the environment within which people live, the opportunities they have access to, the services that are available to them. So I think looking at it in that kind of more broad way. And I think I would hope that this strategy, if it does happen and we manage to create it together, that it is a practical strategy and that it allows for local flexibility. And that is challenging to achieve, but I hope that together we can work out what that might look like. And the reason that I think it needs to be flexible and not prescriptive in a way that lots of strategies can be is so that it enables local people who will want to implement this to adjust it to their particular needs, because we know that communities are different. They have different geographic contexts, different population needs. So it's something that I would like us to somehow think about how could that be integrated into this strategy. And then with the steering group, so we discussed how could we do this. So this is very ambitious and very experimental. So how would we go about doing these? And these were kind of 4 ideas that came up through that conversation that I've kind of summarized a little bit. So the first one was around, well, what should we be looking at? So what would possibly decision makers or policymakers be interested in? And we had a discussion around this kind of, well, what is a rural well-being economy, and should we be looking at that? So trying to link health equity with broader economic and social systems. And it is something that kind of in the policy space is being discussed more. So this kind of concept of a well-being economy, is that something that we should be trying to integrate into our strategy or take some concepts from to be able to perhaps advocate for our points better in the future? So that's one kind of general idea and concept. Another one was kind of scoping reviews of existing evidence. So we know that over the last 20, 30 years, there's been various groups and organizations that have worked on collecting data around rural health equity issues as such. And we are aware that we don't want to be duplicating work, and we want to make use of the existing data that we do have. But part of it is often that we're not aware of all of the work that is being done. And again, this is where the kind of power of the wider community comes into play, because many of you will be aware of something either that's going on locally or that was done by your organization 5-10 years ago. And part of this is bringing all of that together. And we do have a lot of people here who are connected to universities. So there was ideas around, well, could we be using some of those partnerships and maybe turn this into student projects where we could assign certain topics and pull that data together that way. So that was also an idea of what should be done, I guess, before we fully dive into things. And then we were thinking more about, well, how would we be allowing rural and remote and coastal communities to lead this, because we really want them to be in the driving seat. So leading and partnering on this whole process. And we came up with this idea of something like implementation labs. And this would kind of be like a testing ground for the ideas, but also a space to understand what has been done already or what is being done, what is working, why it might be working, what hasn't worked, why it didn't work, and try and learn from all of that information, because often in lots of communities there's been different action, smaller, bigger, and some things have worked really well, and then often it was things like, the funding stopped, or there was some kind of system change that happened that destabilized things. And I think having a good understanding of what has happened already will help us to put together some kind of flexible strategy going forward. The idea we looked at also was, if we do end up having these implementation lab areas, we might need to rename them in a different way, but that we make sure that they're in all 4 nations, so that we can account for the possibly legislative or other contexts that are different between our 4 countries, which I'm sure adds an additional layer of complexity. And then the 4th idea was really around policy engagement. What does that mean? How would we make our voice heard? And around this idea was the concept of storytelling, using stories to, not just data, but storytelling with data to help better advocate for what we're trying to say and do, and also thinking about, as a group and a network, what connections do we have? How could we leverage those connections, and do we actually have a way to build relationships with representatives who could be useful, whether that's local councillors or MPs or other people who might be able to support this idea and who would find this something interesting. So that's what we thought about so far as to how we do this, and we're very open to any comments, other suggestions at this stage. And then we thought about also guiding principles for all of this. So obviously one of the big principles is equity and focusing on a reduction of rural health inequity. We want this to be owned by communities. So we want rural communities to lead and partner and not be subjects of this. We want this to be evidence informed. So we want to build this on data before we just start creating some kind of new way of trying to implement things. We want it to be flexible so that it can be implemented in different diverse contexts across the UK, and we want it to be very collaborative. And the fact that it's collaborative also can make it challenging, because there will be lots of competing interests and things, but we're hoping that this is actually the way forward, rather than the typical kind of top-down approach, which tends to happen with most strategies. We're hoping that if we build a strategy and we show that it's working, that then we can kind of feed that information up the chain rather than it coming down. So yeah, that's where we are at the moment. I'd like to open a few polls just to get your feedback on some of these things that I've mentioned. So give me a moment while the polls are opening. All right. So the first one is around the core themes. And if you could please rank them in the order of importance. So which ones do you feel are most important? I'm hoping that you can see that now. And I'll just give you a few minutes to do that, just to see whether what we should focus on perhaps first.
No. So, what's some chicken? What's some banana? 7 8. Oh,
Okay. So mental well-being and aging population are kind of coming out at the top. Maybe connectivities coming out there as well. Okay. All right, so definitely I think mental well-being is coming out as kind of one of the main things to focus on. Thank you. The next question is around those ideas or strategies for how we might do this. Similarly, what do you feel would be the most important thing to focus on perhaps first, or the most important idea around which we should be focusing out how to? Okay. So definitely looking at the evidence we have, which makes sense, and then possibly tying it in with kind of a general idea of the rural well-being economy. Okay, thank you very much for that. And my last question is a bit of a more broad one to all of you. From your position, what do you or your community or the organization that you work with, what would they need from this strategy? So what would you be looking for? So if you have any ideas, that would be very helpful, just to get your perspectives on kind of what would be the most important thing for you or your organization. Okay, so direction is coming out there, okay. Okay, so I'm seeing a lot on there around practical and realistic directions. Okay, and a definite focus on rural so that it's not sidelined, which is definitely the plan. Okay, and a lot there again around funding is coming out stronger. Okay. And community and collaboration. Okay, thank you very much for that. Always. So the other things that I just wanted to briefly touch upon is obviously this is very complex, and I'm not going to pretend that I have any idea of how this is going to play out, but I do feel very strongly that this is something that we should try and see what we could do and how that might look. I do think that a lot of the knowledge and expertise that we need is in our rural and coastal communities and the organizations that work with those communities. And part of this is also working out how do we best tap into that? How do we start that communication channel? And then that collaborative approach and pooling our existing resources, skills, strengths together. I do think this is probably going to require time, commitment, and some funding because I don't want people to have to volunteer forever. I think that's part of what burns people out in many of these kind of activities. I don't have a good solution for this yet, but I'm hoping, again, as a wider community, that some of you might have some ideas as to how we might go about finding support. Maybe in a national context for national activities or in a UK-wide context for this idea more widely. And I want us to also keep in mind the diverse context in the four nations and how that might influence what we can do in regard to strategic approaches. At the moment, what I've tried to do, as I'm currently based in Wales, I found a call very recently from the Learned Society of Wales, and I've tried to put an expression of interest through for some community workshopping activities around this in Wales. I have no idea how it's going to go. I will have to wait till February to hear back on this, but it's an example of some of the things that we could consider is whether pooling together different bits of funding could work as a way to move forward some of the steps along this process. I'd really now like to hand it back over to you and open the floor to discussion and to think about what are we missing. I have 4 questions to ask. So are there important themes or issues that we're not considering? And what are those? Are we engaging the right voices and who might be missing? Who else should we be bringing into this conversation? And again, if you want to say a little bit more about what you feel would make this strategy useful for your community or your organization, and what are the best ways to keep this collaborative and transparent as a process? So a lot of big questions, but if anyone is ready to jump in, I'm handing it over to you.